Communication is not optional. It is as vital as the treatment itself. A pleasant day to each one of you, together with my group mates Winifred Maravilla, Joy Olayra, Kenji Orosco, Lian, Pacardo, and April Pendon, presenting our research entitled Lived Experiences on Communication Barriers in the Clinical Exposure of the Foreign Nursing Students. Communication is crucial in nursing for building trust, understanding patients, and delivering safe care. Foreign nursing students often face challenges due to language barriers, cultural differences, and unfamiliar hospital settings. In Bacolod City, local dialects and diverse patient backgrounds add to these difficulties. This study explores how these communication barriers affect foreign nursing students' learning, confidence, and patient care during clinical exposure. The study aims to explore the lived experiences of communication barriers in the clinical exposure of the foreign nursing students. Significance of the study: academic institution, nursing educators, foreign nursing students, peers, patients, and researchers. For the theoretical framework, this study is based on Niger's transcultural nursing theory, which emphasizes culturally congruent care and communication beyond language. And lastly, PEPLOS interpersonal relations theory highlights the importance of nurse-patient relations in building trust. Conceptual framework. The diagram presents the conceptual framework linking the student's demographic profile to their lived experiences with communication barriers. It highlights 5 key themes, including language difficulties, psychosocial impact, coping strategies, performance effects, and cultural integration. Overall, the diagram shows how these factors are interconnected in shaping the clinical experiences of foreign nursing students.
For our research design, a qualitative phenomenological approach will explore lived experiences in 3 areas: language, cultural misunderstandings, and nonverbal communication. Data will be collected via face to face interviews. For our participants, the study included 11 foreign BSN students in Bacolod City with dual citizenship, proficiency in English, and active clinical exposure. Those who do not meet these criteria were excluded. For our instrument, a researcher-made interview guide was used, covering participants' demographics, communication challenges, coping strategies, and effects on clinical duties. Data will be analyzed thematically using Leininger's and Peplau's theories. For the data gathering procedure, a semi-structured 15 to 30-minute interview with 11 foreign nursing students. Consent obtained, interviews audio recorded, transcribed, and analyzed using Collise's 7-step method. Confidentiality is strictly observed. For the data analysis, we utilize Collise's 7-step method. Transcribe, review, extract key statements, code, form themes, verify with transcripts, and describe experiences using pseudonyms for confidentiality. For the ethical considerations, ensure participants' rights, welfare, and confidentiality. Informed consent and voluntary participation. Data anonymized, securely stored, and deleted after the study. Study conducted with fairness, integrity, and professionalism.
Okay, so for our results, we have identified 5 themes. For the first theme, it would be Theme 1, Navigating Linguistic Dissonance and Communication Complexity. 1A is Interpreting Deep Dialect Complexities. Those deep Ilonggo terms, I did not know what they meant at that time, Andrew 21. 1B, Translating Medical Terminology. Once they tell me about what's going on, and then I don't really know how to translate it to them, like exactly how to explain it. Then there's like a gap in communication. John 20. 1C is Overcoming Phonetic and Grammatical Hurdles. My pronunciation is not that fluent, so sometimes they ask me to repeat. Judas 24. Theme number 2 is Psychosocial Impact and Reduced Self-Confidence. 2A is Anticipating Pre-Duty Challenges. Even before we get the schedule, I feel like I have a little bit of anxiety going into it. How am I supposed to render care to my patient if they don't understand me? John 20. 2B, Struggling with Professional Autonomy. I had to ask my group mates on what to say next. Andrew 21. Addressing rapport disconnection for 2C. It's still a little difficult for me to build rapport and form trusting relationships. Because sometimes with these barriers, it prevents you from saying what you actually want to say. So I can't properly get to know my patient that well. Matthew 21. Theme 3 is adaptive coping strategies and resilience. 3A is utilizing digital translation tools. I get either from Google Translate, ChatGPT, or the dictionary just to make sure now what I want to say is being conveyed. Thaddeus 21. 3B is collaborating through the body system. I ask my classmate, can you help me talk to the patient? John 20. 3C is engaging in family and community immersion. Just talk to other people, go out and socialize with the people there. Eventually, you learn. Andrew 21.
Theme 4. Perceptions of Clinical and Academic Performance. 4A. Misunderstanding Instructions. Bartholomew 21. It was kind of stressful because I didn't understand them, the staff. I just smiled and waited for someone to translate the instructions. 4B. Encountering information gaps in assessments. Thomas 22. I can't understand it because of their accents. It's overwhelming. I can't get the information I need from the patient. Theme 5. Cultural and Environmental Integration. 5A. Adapting to Environmental Challenges. Peter 23. So it's more like I had to overcompensate and like double my efforts to adjust to the environment. 5B. Drawing motivation from educational legacy. Judas 24. I was motivated by my goal to become a better nurse and make my family proud. After gathering and being able to analyze the statements of all of our participants, the researchers believe that they're able to form a variety of conclusions. Communication barriers affect clinical performance, confidence, and nurse-patient relationships. Adaptation develops through resilience, peer support, and continuous language immersion. Cultural integration and strong motivation promote professional growth and competence. For our interpretive analysis, we have a compass.
Moving on to our conclusion, our study reveals a critical reality. Foreign nursing students frequently hit communication walls during clinical exposure. These aren't just minor misunderstandings. They directly affect the students' confidence, mental well-being, and hands-on performance. However, the takeaway isn't just the struggle, it's the resilience. We found that when students use adaptive strategies, they can still provide effective care. This tells us that if we want clinical proficiency, we cannot leave language and cultural support to chance. It must be structured and intentional. For our recommendation to address these findings, we recommend the following actions. First, establish structured language and cultural support programs. Second, enhance supportive learning strategies in clinical settings. For our administrators, strengthen preclinical briefings and communication simulations. For our educators, prioritize active listening and provide structured, reflective feedback. For our foreign nursing students, proactively sharpen language skills and seek peer collaboration. For local students, foster an inclusive environment through better teamwork. For our patients, engage in clear, culturally sensitive communication. And lastly, for our researchers, conduct broader studies on specific language intervention strategies. The following utilizations are submitted to provide awareness to the college instructors and students about communication challenges faced by the foreign nursing students. Used by the College of Nursing to enhance training, support systems, and strategies for effective patient interaction. Lastly, serves as a reference for future research to improve curriculum and clinical practice in multicultural settings.
We would like to express our sincere gratitude to all who supported and guided us throughout this research. Foremost, we extend our deepest appreciation to our Nursing Research 1 and 2 facilitator, Beth, Diva, RNM, and PhD, for her expert guidance and unwavering support. We're equally thankful to our Nursing Research 1 lecturer, Sheilla Trajera, RNLPT, and PhD, for her valuable feedback and continuous encouragement. We also sincerely thank our panel members, Dr. Tony Ann La Chica and Dr. Geraldine Abelia, for their insightful comments and meaningful recommendations that enhanced the study. Moreover, we are deeply grateful to our families and friends for their constant love and support, which sustained us throughout this journey. Above all, We give our highest praise and gratitude to Almighty God for His guidance and blessings in making this achievement possible. Thank you for listening.